here again, and we are here with Lisa. That's my sister. She's a nurse in the mental health department, and she will be helping us tonight to discuss the topic on mental health, how to identify mental health, what you can do, and all of those things. All right? Okay. So, Lisa, good night.
Good night.
Well,
How are you doing?
I'm fine. Welcome to my live. And tonight, as you know, we are going to be discussing the topic on mental health and how to identify mental health. Can you first explain to us what is meant by mental health?
Okay, mental health is kind of broad. It's a kind of a broad topic because, like, it basically would cover like your mood, how a person is feeling,
Yeah.
and sometimes the way how we're feeling, first is kind of act it out. Some persons will verbalize their feelings.
Mm-hmm.
Some persons may not verbalize their feelings. You'd actually see it in their behavior, like a behavior change in their behavior. They would start to do things that they don't normally do. Like, for example, persons can become increased aggression. They
Mm-hmm.
can be increased sadness. You can see persons eating a lot or eating less. Persons can be sleeping a lot, sleeping less. Um, it can be changes in their overall behavior.
Okay.
Withdrawn, they can become withdrawn. They can become more irritable.
Okay. So these would be the signs and symptoms that you would look for in a family member that is portraying signs of mental health, right? So
Yeah, sometimes.
so is it that a case that it goes through stages?
Yes, it can be. It can go through stages. Like some of them, it all depends. You have many different types of mental illness, and many different types of symptoms.
Mm-hmm.
And some of them, as I mentioned about certain behavior, but you also have another illness that you like that can be like hallucination. That is when persons are hearing voices, they're responding to internal stimuli, and
Mm-hmm.
sometimes these things can happen suddenly or can happen over a period of time. Sometimes these things can cause from substance induced, like we call it substance induced psychosis, when someone suddenly start hearing voices, kind of regular with persons that smoke marijuana. It doesn't happen to everybody, but it happens a lot with
Okay.
persons who use marijuana and other illicit drugs.
Okay. 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 So in the case of having a family member and um they are displaying these symptoms, what is the first recommendation for them?
One of the first thing you could try to do is try to talk to the person, to see get them to open up about what is going on with them. Um, if there's like you can get them to explain what is going on, because you may not see all the signs. So if you can get them to open up, they
Mm-hmm.
can tell you. And one of the most important things to say, if they're having suicidal thoughts,
Mm-hmm.
because that is very important. And if someone is having suicidal thought, do not hesitate to get help. That means like taking them, like if we have a suicide hotline, we'll call that suicide hotline or take them to the hospital to
Mm-hmm.
be evaluated. Because that
Okay.
is very important. That can help to save someone's life.
Okay, and that is the most dangerous part. So, what about those who are mild, like persons who find themselves just talking to themselves unnecessarily about everything, laughing, and withdrawn? How do you angle those persons?
Well, for those type of symptoms, yes, we'd want to. Some of those are like psychotic features, and most persons who are having psychotic features, they may have poor insight and poor judgment, so they may not be aware that something is going on wrong with them. So Usually, family members may have to intervene and try to get them to the hospital or to get evaluation. And once they get evaluation, they may need to start some form of medication to help with reducing voices.
But
psychotherapy also helps.
okay.
Sorry.
I realize that persons who display this issue, they tend to don't believe that something is wrong with them. Why is that?
Well, some of them may think that that is called insight. So if they have insight to say something is wrong with them, that is a positive sign. Because if they admit that something is wrong with them, then they would be more receptive for treatment, or should be more receptive for treatment. Which treatment can usually include psychosocial therapy, which is therapists, a counselor, therapist to help them, develop some coping skills and ways how to, reduce these thoughts, or medication. If it reaches a certain level, psychotherapy alone cannot help. They're definitely going to need medication. But if they have insight, as I mentioned, that is good. If they don't have insight, that can be more dangerous, because that means they may resist treatments.
Right. So in that case where they don't have the insight and they are resisting treatment, what next?
We may have to find a way to get them to the hospital. I'm currently living in the States. Here in the States, I'm not sure exactly how they do it in Jamaica, but you can call the police, and once the police intervene, they will take them to the hospital, and the doctor can they can order them to stay, like they have a court order for them, so that the person cannot refuse treatments. So they will actually initiate a court order, because what they would say, they may be a danger to themselves or to other persons.
Okay.
Because if you're having mental illness, you're doing things maybe can cause harm to yourself, and you don't want to have treatment, then the court can give an order with the doctor initiating it for them to get treatment.
Okay, very good, very good. That means in that case they wouldn't have any choice in the matter.
Right, they don't have the right to refuse once they're at a certain stage. Like if they're having command hallucinations, like persons are hearing voices telling them to hurt themselves and telling them to hurt other persons, and you notice increased aggression. So once you have that evidence to say, hey, because some person may start hurting themselves, or they start attacking other persons and aggressive toward other persons, they cannot refuse treatment, because that means they become a danger to themselves and others. So the doctor can give initiate for the court. They can sign up a paper called emergency hold, and they will send it to the court, and the court, once they sign to the court, the person can be admitted and receive the treatment that they need.
Great. So for those who are on treatment, and I guess in the hospital they will be able to take the medication because they can put it in the drip or whatever the case, whatever the way they choose to get the medication in their system. When they come home, how and they refuse to take the medication, how can family member help them to take their medication as prescribed by the doctor?
Well, that can be a challenge for them if they're not receptive. Usually persons would be sent home person on PO medication, that's oral medication. If they're missing their medication, then they may do a monthly injection. But sometimes some persons may still put up a resistance. They don't want to go to the clinic like each month. So sometimes the community health center has person from the mental health team that would go into the community and try to retrieve these persons and actually just try to get them. Once a family member would identify them and say, okay, this is this person, they would have their medication ready, administer it every month in order to maintain stability for that patient.
Okay, nice. All right. Is there a number to the amount of different types of mental illnesses that exist?
There's a whole variety of them. Like we
Can
have a
you
book called the DSM-5. It's like a dictionary, like it's like a mental health Bible. So you have like from schizophrenia, that's usual, like you're hearing voices. You have the bipolar, which when you have like elevated mood or depression. Depression is another mental illness. You have the substance use abuse. Those are another issues that can cause mental illness. You have like for elderly, like dementia, Alzheimer, Parkinson. There's a whole lot of them. For children, you have the ADHD, which a lot of parents miss, because like children may be at school and they may not focusing well. They may be distracted, they may be hyperactive, and person may say they're rude there, but they may really have ADHD, and a lot of people it goes undiagnosed, and a lot of children struggle because of it. So you have a whole bunch of mental illness for children, adults, elderly. For children, and I mentioned ADHD. You have oppositional defiance, like some children that they don't listen to parents, they don't listen to teacher, they break every rules, all of that. You have personality disorders. Personality disorders come in different types. Like you have the avoidant personality disorder, you have the antisocial. The avoidant is like they don't want to be a part of any social group. You have like the antisocial personality disorder. Those persons are persons who will commit crime and they don't see nothing wrong. They don't have no remorse to whatever they justify that what they're doing. Mm-hmm. They do it because of a particular reason. Then you have like borderline personality. Those persons struggle with relationship. Like if someone leave them, they want to commit suicide, and you have a whole lot more. Okay. Those are just some of the few.
Okay, so when it reached to the point where persons are naked and walking on the road eating out of the garbage, what is that stage?
They may be like having a psychotic episode, and I can think schizophrenia can possibly cause that. Maybe persons are in a manic bipolar stage, because bipolar are going two stages. You have the part where they're really depressed and the part where they're manic, where they don't know themselves. They just involved in risky behaviors and all. Schizophrenia, that would be the type that persons may be dirty, they're unkept, they're not aware of what's going on around them. They can't recognize their environment, what is healthy or what's not healthy, because it's like they have altered mental status. Their judgment is impaired. Mm-hmm. They have no insight or little or no insight. So persons who have schizophrenia and it's not treated can find themselves in that situation.
Okay. And when they reach to that stage, is there any coming back for them?
Yes, but everyone is different. So it's like with the brain, it's kind of work in mysterious ways. You have some person may receive the treatment and they may be receptive and it works very well for them, while some persons, they may be in such a state where despite treatment, they will still having all the symptoms. Some persons, the symptoms may reduce, some persons, the symptoms may go away with treatment, some persons still have the symptoms like intermittently despite they're on treatment.
Okay. All right. Very interested. Very informative. All right. So is there anything else that I may have missed asking that you would want to say?
We may have mentioned it initially, but it's very important for family members. If you see that your family members are acting any way different, try to intervene, find out what's going on with them, and try to initiate early intervention. Because early intervention kind of help to reduce severity of mental illness. So when you intervene early, it's a better chance for the person to come back 100% rather than they're there and not getting treatment for a long time. It's gonna make it's like the disease is gonna go into a more severe stage, and it may be harder for the person to come back to their 100% function.
Okay. What are some of the names of the medication used um, for persons in severe cases or even mild cases?
Okay, it's based on the disease, the type of mental health issues or diagnosis. So, like for depression, you have a class of medication called antidepressant. You have several different antidepressants. One of the most popular one are called SSRI. So you have like under SSRI, it's like you have different categories, and then under each category you have a list several lists of medication. So antidepressants, you have like Lexapro, Prozac, Zoloft. Those are the common ones, and you have many more. For psychotic feature, like for schizophrenia, you have medication they call antipsychotic medication used to treat hallucinations and delusions. Because first you can have false fixed beliefs, like person can believe. I see met persons who say their mother is their parents is not their parents. They can't identify them, and nothing in the world can tell them say, okay, yes, this is your mother. So they have that psychotic break, that the things that they usually familiar with, they have a distorted thinking. So for those type of psychotic behavior, we would give them an antipsychotic. Some of the most popular ones, you have the haloperidol, called the Haldol. You have the risperidone. You have the Abilify. You have so much of them, and you have some older types and you have some newer types medication, because they're always developing new medication. Wherever they have some severe side effects to the older ones, the newer medication kind of have reduced side effects. So that persons can be more receptive to take their medication. So the antipsychotic, you have those for the depression. Like for bipolar, you give medication called mood stabilizer. So for mood stabilizer, you have like lithium, Depakote, you have the quetiapine, you have a whole bunch of them.
Okay.
But those are some of the few of the common ones.
So question, are these medication, when you go on them, do you ever get off them? Is it that you get stuck on them forever, or you will get better and get off them?
Well, it all depends on the diagnosis. Like for depression, someone can be going through a phases in life and they become depressed, and they need medication for support. So usually they will be on the medication for about 6 months. If they improve after the 6 months, then they can wean off the medication. But this disease process or mental illness such as bipolar and schizophrenia, they are chronic. So it's just like if you have like diabetes or hypertension, you can't really say, okay, I'm going to stop taking my diabetes medication or my hypertension, because you can, when you stop taking it, your illness can reverse, can come back. Or if you get better, you can end up back to square one after stop taking the medication.
Okay, great. I really enjoy listening to you. Very informative. And I guess everyone on the live should be learning something and know more how to take care of their friends and family that are around them, and to look out for them, and at the sight of the least things, no matter how small it is, take the initiative to get them help. Like therapy can help too, like in mild depression, right?
Yeah, definitely. We literature as research and the literature has proven that therapy is usually you would start with therapy for like depression. If therapy alone is not helping after a certain time, that's when they start medication. but they said therapy is normally first choice, and then with both of them, therapy plus medication, it would give the person a better chance of full recovery and success.
Okay. All right. So that is it. That's it for tonight. Mental health and taking care of our family and friends with mental health, how to help them, what is expected, and so on. As we leave, Lisa, can you give your final thoughts and encourage those who are viewing now as to how to move forward mental health, even with themselves?
Yeah, what I want to outline, having a mental illness is not a disgrace, it's not a crime, it's not you do anything bad or a curse or anything. It's just like any other illness in the world that, we don't have any control over. So if yourself or a family member or friend have mental illness, be supportive, try to get the required help that you need. Support if it's a friend or family, you support them. We're not gonna, discriminate or anything, because it's not something someone caused on themselves. It's just like any other illness, like hypertension, diabetes, seizure, asthma. Just like it's just that has to do with your mind, and getting the help that you need. Nothing is wrong with that. Taking medication for mental illness, nothing is wrong with that either. It's just getting the help that you need so that you can be the best you.
Okay. So thank you, Lisa, for coming. It was a pleasure having you here. You did well, and we appreciate it. And for my blessed team, this is it for tonight. Thank you for joining. Please like, share, subscribe to a friend and a family so that they can join when next we come with another very interesting topic. Thank you all for being here. Love you, love you, love you.
Thanks for
Bye.
having me. I enjoy. Thank you.
Okay.
All right, bye-bye.
Lisa,